Addiction from opiates and alcohol is a huge problem in America. This is why I'm going to share with you a protocol that saves lives. It will minimize withdrawal, it will help you to avoid relapse, and it will protect you from overdose. It seems to us that still not many people knows about the solution, how to do that. So let's begin. Let's start from withdrawal. Let's look on the options that are available in America at the moment. And one of the common options is a opioids full agonist, like methadone, heroin, fentanyl, oxycodone. In my opinion, they never should be chosen or used, because if you have an alcohol addiction and you start using them, you will change one problem to the other. You will become dependent on these substances, and it may take up to 7 years to get rid of addiction from opioids. If you have an opioid addiction, also you shouldn't use them because they stimulate your opioid receptors in your brain too much, and you can still get high and you can still get dependent on these drugs. That's why you should use something that will not make you dependent, and there is an option. On the other hand, we have an option that is very common called turkey. It's basically vomiting, agony, and unbearable pain for many days, because basically what it does, this method is all about stop taking it from day one, which is actually bringing very severe withdrawal, and it's completely avoidable. And how is avoidable? Buprenorphine is the answer. It's something that we use. Buprenorphine is a half antagonist, which means it doesn't stimulate your receptors that much. So it's not gonna get you high, it's not gonna make you dependent, but it's strong enough to get you through withdrawal. And it's going to be like a transition, smooth transition, where withdrawal is just manageable. It's very important to remember that you're not supposed to use buprenorphine as a pill or injection to manage withdrawal. Only patch do the job. And the reason is because with pills and injection, you will go through waves of protection. Protection will be higher, lower, higher, lower. With patch, it's going to be stable. Another thing is important to remember, that with patch, actually you can taper it down, so you can lower the dose very easily. So basically we lower the dose every single day to get the patient to the stable state every single time until he is on the lower dose. And after 24 hours, we take it off and this person basically becomes clean. It's very simple and straightforward. This is not the end of the recovery. It's actually very the beginning, because then we have relapse, which actually may happen for the next 7 years, because once we are addicted to something, we change the brain chemistry. Our brain chemistry is completely different, and it takes up to 7 years to change it back, to bring it back, this chemistry that was originally. How to avoid it and why we relapse? It's basically physical dependence, that the chemistry is changed, and when we do not use, it's basically feeling like we do something against ourselves, which is actually in real life very difficult. We never would do anything against ourselves. So when we addict it and we don't use, it's basically like we do something against ourselves. That's the feeling. That's what the brain thinks, and it's very challenging. We have a few common ways to manage the cravings: counseling and motivation, trigger management, and support network. So counseling, about 80-90% relapse, way too much, because you go on a meeting once a week, and for the rest of the time you depend on yourself and your thoughts, which actually are very destructive. That's why it's very difficult to stay clean using only this method. Motivational could be very exhausting, because you cannot be motivated all the time. No one is motivated all the time. Motivation comes and goes, comes and goes. That's why people are relapsing. Trigger management is a little bit better, because you're learning what actually make you relapse. Unfortunately, you learn on your mistakes, which is you relapse and then you have to go back to withdrawal, which is actually sad, and you can avoid that. Trust me, this is not really necessary. You don't have to relapse at all. Support network is actually pretty good, but many patients after such meeting, they basically go on the street and they use again. On the meeting, they think only about using or not using, but still is thinking actually about using. And the solution we do is naltrexone. Why naltrexone? Because it's a drug that actually turns off your opioid receptors. What's happening, you stop thinking about using, and even if you're going to use, you're not gonna feel anything. It completely blocks your opioid receptors, do not allow anything attached to it, so you don't have to think about using again. You're not even going to think about using again. You will not want to think about using again. It's going to be thinking about grass or broccoli. It's not gonna mean anything to you. That's how powerful naltrexone is. You need to remember there's 3 different ways to deliver naltrexone. The first one is pill. Unfortunately, a lot of people, they get prescription, they won't even fulfill this prescription, they become vulnerable very quickly, they're using again. Those who take pills, knowing that naltrexone is actually powerful, what's happening after a couple of weeks, they feel very good very quickly, and they come to conclusion, I don't need to use anymore, I don't need to take pills anymore. They stop taking them and they go back to using because relapse is coming very quickly. They're just losing again with their thoughts. Vivitrol was improvement because it's an injection done every single month. The problem with Vivitrol is that every next injection wears off much more. So the first injection works 30 days. The last one will last only for 12, 11, sometimes 14. So you have a lot of gaps when you're vulnerable, and still up to 60% people, they relapse even with Vivitrol. So when we consider all these different ways and methods, how much money, time and energy we put into it, and it's not even worth it because people relapse and they gotta go through withdrawal again. And then we have an implant. Implant is different because once placed in your abdomen, it gives you 15 months of peaceful mind and time to recover. And that's a game changer. 85% of people who take naltrexone implants, they get out of addiction and they recover fully and they never go back to their addiction. This is very powerful because it gives you that time, space, and peace where actually you can go and combine all this method together. When you have an implant in your body, naltrexone is in your blood, you can go do counseling and you actually have a normal conversation without thinking about taking the substance of your choice. You can be motivated or not motivated, it doesn't matter. You're not gonna have a cravings anymore. You're not gonna think about drugs anymore because it's not gonna give you anything. Trigger management, okay, that may help anyway, but even if you're gonna be triggered, you don't wanna take. And if you're gonna take, nothing gonna happen anyway. And the support network, actually, okay, that's fine. When you have a naltrexone implant, you go on a meeting, you talk to people, and actually you can focus on what people are talking. You don't need to think about, and you don't want to think about, and you will not think about the substance of your choice because it's not gonna give you any pleasure. So that's how powerful is naltrexone, but only when you have an implant, because Vivitrol and pills, basically they require human compliance, which is actually very low in addiction sector. So let's talk about now overdose. Why risk is so high? Basically, it happens because you lose your tolerance and your previous dose becomes your lethal dose. Not many people knows about it, unfortunately, and that's how it ends, which is actually very sad. What helps? Naltrexone again. If you have no cravings, if you don't relapse, guess what? It's impossible to overdose. So even if you're going to take anything, any substance of your choice, it's not gonna do anything. It's not gonna get you high. It's not gonna get you overdose. Basically, you're not gonna feel nothing. It will go through your body. It will get in here, get out there. That's it. How it happens and why? Basically, naltrexone blocks your receptors in your brain, opioid receptors. There is no high, no euphoria, up to 90% mortality reduction. There was a study done in Australia. 638 people have been checked on heroin and other opioids. There was 12 interventions with overdose that required hospital. After naltrexone implants, there was 0. So we don't talk about reduction, we talk about complete elimination of overdose, which is actually very good news. So far we cover what to do to not have a withdrawal, how not to relapse, and how not to overdose. The answer is buprenorphine and naltrexone implant, which is actually the best. So how the recovery with naltrexone actually looks like and feel like? There is no fear, because you don't have to be afraid of withdrawal. You don't have to be afraid that you're going to relapse and go through withdrawal again, and you're not gonna overdose. Even if you're going to use, there will be nothing out of it. Brain heal. So basically your brain starts to learn that there is no pleasure in taking anything, any substance of your choice. No cravings because there is no thoughts, no fights. So instead, going through life and fighting with your thoughts, basically you start building your life. You start focusing on family, career, life, health, and everything else that is important, like kids or anything else. If there is no cravings, there is no relapse, which means you're not gonna disappear for days. Family will not go in to search you because you're not gonna relapse anymore. And this is huge game changer. And it was for us. Mental stability. You start using all these methods like counseling, motivation, trigger management, support network, all together will rebuild your mental health. Instead fighting every single day with your thoughts, you will just start building your life and yourself. So you are no longer an addict fighting your triggers and urges. You just become a normal person that actually goes through life and enjoy this life building whatever you really care about in your life. Naltrexone implant is not available everywhere, but if you contact us or you just give a comment free under this post, we are going to contact you and we're gonna let you know how you can put your hands on naltrexone implant.